Hello, viewers. Good evening. This is a wonderful day that the Lord has made, and we will rejoice and be glad in it. Yes, I'll bring you another wonderful package. This is a very important package and very, very sensitive. Yeah, because we are going to talk about health. All right, so this is We Can Gist with Rachel Langs on Husky TV and FM. And with me here, it's a wonderful person. He's going to do justice to whatsoever we're going to talk about. And I remain your favorite host, Rachel Langs. But stay tuned, we'll return back shortly and then he will introduce himself. Then we'll tell you what we are going to do right away. Stay tuned and don't go anywhere. All right, welcome back. And this is Weekend Gist with Rachel Langs, and we are going to talk about kidney failure. This is Dr. Caleb, but I think he would call the other second name. I don't know.
All right, then. Thank you very much. Thank you for having me on your
Yeah.
show, Rachel. And my name is Dr. Caleb Agada, and I'm
Okay.
happy to be here.
Yeah. And I am also happy to be here with you because I'm going to learn a lot on how to keep my kidney healthy. All right, so we are going to talk about kidney failure. Yeah, it's important to anyone at any age, gender, wherever you are. It is very important that you learn how to keep your kidney healthy because they say health is wealth. Do not allow it to get to a stage whereby you have to start running up and down. Okay, be checking your kidney and whatsoever that is need to be done should be done rightly. When you do anything, just one thing wrongly, and then the whole of the thing goes wrong. So let's learn how to maintain our kidney with Dr. Caleb Agata, right?
Yes, you're correct.
Yeah. All right. So Dr. Caleb, before we go further, let me ask you first, what is actually kidney and what is the function of kidney in humans? They function the same thing in animals too, right?
Yes, that's
Okay,
correct.
so now we're talking about humans, we are not talking about animals. Yeah, so you help us so that we understand what is the function so that we know how to handle it very well because we might just feel it's just normal hair, we can just cut it anyhow, anytime, any moment. But if it's something that we cannot tamper with like that, then we should learn how to maintain it, right?
All right, then. Thank you very much for the question. So the kidneys are a pair of organs that are found in the body. So
Okay.
meaning that a normal individual should
Mm.
have two kidneys. So they
Okay.
usually come in pairs. They come in pairs, and they are kidney shaped. They are found in the body, and then it carries out several important functions in the body. The
Okay.
functions of the kidney are several, and they are really, really important. So
Okay.
number one, the kidney is the organ that is responsible for filtration of blood.
Okay.
And as a matter of fact, the kidney is responsible for formation of urine. So it
Oh.
helps to reduce the quantity of water that is in the system. There are different ways that water leaves the body. It
Okay.
can leave through sweat.
Okay.
It can leave through breathing.
Okay.
Yes, exchange of air. So as we breathe out, water is
Mm.
also lost.
Oh,
Whenever
yeah.
we talk, whenever we speak, water
Okay.
is also lost.
Okay.
However, through urine is the major way through which water
It goes
leaves the
down.
body. Another function of the kidney is
Mm.
the removal of waste, the
Okay.
excretion of waste from the body. So there are harmful substances that are found in the body,
Mm.
byproducts of metabolism that have to be removed, and
Okay.
these are removed by the kidneys. The skin also plays similar function. However, the kidneys play a very important role in
It's just
removal
like the
of waste.
master machine.
Exactly.
Okay.
The kidney does a lot in the body.
Okay.
In the body. As a matter of fact, when you see how small they are compared to the
Mm.
functions that they carry out, it's really amazing. God is really
It's
wonderful.
wonderful.
Yes. Another function that is carried out by the kidney is they are also responsible for the formation of red blood cells. Red blood
Okay.
cells. Yes. So there's a particular hormone or
Okay.
substance released by the kidney. It's called the erythropoietin.
Mm.
It's called the erythropoietin. So what the erythropoietin does is that when it is released by the kidneys,
Mm.
it goes to act in certain parts of the body. It can act in the bone marrow for the production of blood. Uh, Another function of the kidney is also bone formation.
Okay.
Bone formation, yes. So the kidney plays a very important role in metabolism of vitamin D.
Okay.
Yes, so these are some of the key functions that the kidney carries out in the body.
Hmm.
And as body,
Yeah.
when it tends towards alkalinity, there will be issues in the body. So
Mm.
there is that neutral point that the pH of the body has to be maintained around 7.0. So the kidney helps to maintain the pH of the body
Okay.
within this limits, within
Okay.
this range. Another
Okay.
function of the
Mm.
kidney is that it helps to
This kidney.
the kidney does a lot, a
No,
lot. It's
me,
really
the one
important.
that is actually striking me is the formation of bones.
Oh
Like,
yes.
okay, I'm just hearing that for the first time. Yeah, don't blame me. I'm not in the line of
Yeah.
all of this. So I'm just hearing it for the first time. And okay.
Yes. So I was going to say finally that the kidney also plays an important function in maintaining the balance of electrolytes in the body. So there
Okay.
are certain substances in the body known as electrolytes: sodium, potassium, magnesium,
Okay.
calcium,
Uh-huh.
and all of those. So they have to be maintained within a proper range for the
Okay.
body to function properly. For example, the heart beats
Mm.
because of the activities of these electrolytes.
Mm.
Other muscles in our body function properly because of the activities of these electrolytes. In fact, our brains
Mm.
function by the activity of these electrolytes. So the kidney helps to maintain the proper concentration of the electrolytes within the body.
Mm. Huh. Yeah, I'm blushing, I'm laughing because the kidney I know, she is the one I know.
Exactly, that same kidney
Wow. Is actually overworking.
does a lot.
That's
Does a
serious.
lot.
All right, so we move ahead. Before I will ask you the second question, let me just go to the third question because we need to know what actually causes the damages first. Then you tell us how to maintain and not to get up to the level of having a damaged kidney whatsoever. All right, so what actually causes kidney failure?
All right, that's a very
Oh,
good
no, no,
question.
no, no. All
Okay,
right, so can we start with the
okay,
symptoms?
okay, all right.
Oh,
I think we can start with any.
okay.
Yeah,
Okay, so what causes the
okay.
kidney failure?
All right, so there are causes and then there are risk factors of kidney failure. I would
Okay,
like to classify them into acquired causes and
okay,
congenital causes. So by congenital, I mean there are issues that may arise because this person was born with a faulty kidney.
okay,
And then there are persons who were born with a normal kidney,
okay,
however, along the line, over time,
mm,
the kidney becomes faulty. So that is for the acquired. Yes, so
okay.
there are persons who may be born with, remember we said kidneys come in pairs. So
Yeah.
there are people who may be born with one faulty kidney.
Hmm.
Yes, so there are
One and
people
yet
who,
is faulty.
yes, one faulty kidney.
That's dangerous.
Emphasis on one faulty kidney because there are people who actually live with one kidney. They live on one kidney,
A healthy one.
a healthy kidney, exactly.
Okay,
So people can actually depend on one healthy kidney, and that's why it's possible to donate a kidney to
okay.
someone else,
Mm.
and you can survive on the one
One
kidney you have, and the person that is receiving your
can
kidney
survive
can
with
also
the
survive
other
on that
one.
one. Yeah, so the emphasis is on having a healthy kidney. So there are persons who are born with one faulty kidney, horseshoe kidneys,
Mm.
kidneys that are not properly uh, placed,
Mm.
and then with poor morphology in the body. So apart from that, acquired causes of
Mm.
kidney failure, they include, it may arise as a result of dehydration.
Okay.
Yeah, so dehydration is one of the commonest causes of kidney failure. By the way, kidney failure is a broad term. So
Mm.
there are actually two types of kidney failure. We have acute kidney injury,
Okay.
yes, and then we have chronic kidney disease. So the difference between these two, acute actually means something that happens suddenly.
Okay.
Yeah, so the word acute means sudden. However, chronic means over a long period of
Period
time.
of time.
Yeah, so there are
Okay.
people whose kidneys shut down all of a sudden.
But
So
what can actually cause that?
all of
Just
those. Yes, I'm
all of
going
a
to mention the
sudden.
causes of each of them for the acute
Okay.
kidney injury. So for the acute injury, a kidney injury, uh, one of the causes of that AKI is dehydration.
Okay.
Yes, remember I mentioned that that is one of the commonest causes of kidney failure in our environment. In our
Okay.
environment, being sub-Saharan Africa, the fact that it is very dry, can be
Mm.
really dry, and the
Mm.
temperatures can be high.
Mm.
So as a result of that, people tend to sweat a lot.
Yeah.
Even when we speak, people lose water a lot, and then people pass a lot of urine.
Yeah.
So as a result of that, people are prone to coming down with dehydration, and whenever there is dehydration
Mm.
for a long period of time, there's likelihood of having kidney failure. Okay,
Okay.
yeah, so that's one of the
Sudden one.
major, yes, sudden kidney
Kidney
failure. That's
failure.
acute kidney injury now.
Yeah.
Yes, so one of them is dehydration. Another cause is trauma.
Okay.
Trauma, yes. So trauma simply means overwhelming impact to the body
Mm.
that leads to injury. So I give an
Okay.
example. Someone is involved in a road traffic accident,
Yeah.
and let's say the person's leg is crushed, the
Okay.
person's thigh is crushed. So as a result of that, remember the kidney plays a major role, a vital role in excretion of
Yeah.
waste products from the body.
Yeah.
So there are certain substances in the body called myoglobin. Myoglobin is found in the muscles. So
Okay.
whenever the muscle is crushed, what happens is that these myoglobins have to be excreted by the kidneys. But because of the overwhelming amount
Mm.
of the myoglobin,
Mm.
they injure the kidney. Yeah,
Okay.
so because of the overwhelming amount of the myoglobin, the kidney fails to excrete everything, and all of these can cause acute kidney injury to an
That's serious.
individual. Yes, and then aside the trauma being elsewhere, there can be direct trauma to the kidney itself.
Mm. Okay.
Yeah, so this can be a direct trauma to the capsule of the kidney, or
Mm.
this can be a blunt trauma. Blunt trauma, I mean the kidneys are located within the abdomen. They
Yeah.
are retroabdominal organ, somewhere behind or within the abdomen.
Okay.
So a blunt trauma means that the point of impact is on the person's skin or muscle,
Mm.
but the vibratory force extends to the
To the
kidney. So
kidney.
it's not a direct contact with the kidney.
Okay.
However, the vibratory force extends to the kidney, and this can lead to kidney failure also. So these are major causes of kidney failure. Another cause of acute kidney injury
Mm.
is kidney stones, what
Okay.
we call nephrolithiasis. So kidney stones, stones can form in the body,
Mm.
and then within the kidney capsule, within the glomeruli, or within the ureter. And
Mm.
then when this happens, it leads to an obstruction in the flow of urine. And
Okay.
whenever there's an obstruction to the flow of urine,
Mm.
what happens is that there will be a collection of the urine within the
Okay.
ureter,
Yeah.
and it will pull back into the main kidney capsule, and then
Okay.
this can lead to injury of the kidney itself. So
Hmm.
these are major causes of acute kidney injury. And then
Okay.
we also have causes for the chronic kidney
Okay.
disease.
All right.
Yes,
That
so
one.
for the chronic kidney disease, remember I mentioned that this happens over
A
time.
period of
Yeah,
time.
over a
Long
period
period
of
of
time.
time.
Yes, we usually say over 3 months.
Okay.
Yes, it usually occurs over 3 months. And some of the causes of this include, but are not limited to, hypertension.
Okay.
Yes, hypertension has been implicated in causing kidney disease. Also, diabetes mellitus.
Okay.
Yeah, so diabetes also plays a role in causing chronic kidney disease. Then smoking.
Okay.
Smoking also plays a role in causing kidney disease. And then it has also been shown, recent research, that intake of what we call gargagia, which is
Mm.
herbal medications,
Concoction.
herbal concoctions, they tend to also lead to breakdown, because remember the kidney is responsible for the excretion of
Mm.
all of these waste. So whatsoever you are taking into your body, the kidney plays the role of excretion. So the kidneys are actually at the receiving end
Yeah.
of all of
Everything
this.
that you're taking.
Exactly, they are the receiving end. So another cause of chronic kidney disease, it includes urinary tract infection. So
Okay.
whenever there is an infection of the urinary tract, say the urethra or the ureters, this can spread into the kidney, and then it can lead to pyelonephritis.
Okay.
Over time. This can also result in chronic kidney disease. And
Okay.
then finally, another cause of it is polycystic kidney disease. It's actually a congen is a is a product of genetic mutation. So persons
Okay.
are born with it. So
Okay.
it is likely to be inherited.
Oh.
Yeah. So it is called polycystic kidney disease. Can
Hmm.
lead to chronic kidney disease.
Okay, so you talked about smoking
Yes.
and all these gargagia, these local herbs we usually take by the roadside, not knowing what is mixed in the bottle, not knowing the person is selling, and even the person don't actually know the percentage,
Yeah.
which how much he's supposed to give you because he don't the person she or he don't even know what is actually going on in your body without a test. They just want to, okay, I'm having running temperature or whatsoever, they just want to give you something to take, and actually probably you can actually calm it down, and then you don't actually know what is going on inside of you because your temperature is actually calm, but probably there is a damage that has happened inside of you. So all of these gargagia, whatsoever sellers and the takers, be careful, more especially those that usually use their money to buy wahala for themselves. And then I'm moving to smoking because this one is very, very important to me. Smoking, okay. Um, I've heard a lot of people say, probably someone will say, why are you smelling weed or cigarette? No, I do not smoke. With someone that sat close to me and smoke and whatsoever. So, what do you think happens to the person that inhales the smoke from the smoker?
All
Let me
right.
put it like that.
All right, that's a very intelligent question. And there are actually two categories of smokers.
Yeah.
There are active smokers and
Yeah.
there are passive smokers.
Okay.
So active smokers is that individual or are
Okay.
those individuals that literally take the stick of cigarettes and then inhales the
Directly
the
to their
cigarette
mouth.
smoke.
Yeah.
Exactly.
Okay.
However, passive smokers are
Mm.
bystanders,
Okay.
people who inhale the exhaled cigarette smoke.
Mm.
By that I mean the person smoking the cigarette, the active smoker,
Mm.
takes it in, exhales it.
Yeah.
What comes out at the
Yeah.
end of the day,
Yeah.
plus what comes out from the other end of the cigarette,
Mm.
is now being inhaled by a bystander.
Yeah.
So that bystander that is inhaling all of those
Mm.
is now the passive smoker.
Okay.
And the person with a greater risk or at greater risk is actually the passive smoker, the bystander who is perceiving everything. Now, that doesn't mean that the active smoker is not at risk
Okay.
himself, but the person at greater risk is the bystander. Reason is you are inhaling what that individual had inhaled, plus the whole um, systemic air and everything is now being exhaled. There are, mind you, there are persons with lung diseases.
Okay.
Yes, there are people with lung diseases. So, as a smoker, after inhaling the cigarette smoke, all of the microbes within the lungs is now mixed with the cigarette smoke and exhaled. So the bystander now inhales everything. Apart from that, at the other end of the cigarette, it has been shown that the other end of the cigarette is more toxic than the part that is being inhaled.
Okay.
Yes, as a matter of fact, the other end where is usual the place that is usually
the filter, the
exactly the other place that is lit is said to contain certain carcinogens. By carcinogens, I mean things that can cause cancer.
Okay.
Yes. So that part is really toxic. So as a bystander, you are inhaling that other portion and you are inhaling what the person smoking is breathing out. So it puts the passive smokers at a greater risk of coming down with issues, both lung issues,
and
pulmonary
kidney.
issues, and kidney issues.
That's dangerous.
Yes.
All right. So what happened to the men boss?
Okay, okay. For the person who is
Yeah.
inhaling it, first of all, the first point of excretion of all of those is
Mm.
the lungs.
Yeah.
Yes. So while it goes into the
Mm.
lungs are at risk of being damaged.
Okay.
Yes, and that's why persons that smoke are liable to come down with things like lung cancer,
Mm.
liable to come down with things like COPD and all of those. But then for that question, so it's usually advised not to make a fireplace in an enclosed environment.
Okay.
It is important to make your fireplace in an outdoor environment.
Okay.
As a matter of fact, it is highly discouraged to use firewood in
Mm.
making fire. Of
Okay.
course, I know in a lot of climes, including our climes, that's
Mm.
like the cheapest
Mm.
means
Cooking.
of cooking exactly. But then, apart from the fact that it plays a role in deforestation,
Mm.
in also climate change,
Mm.
it's also harmful to the individual because every smoke that is being inhaled results to injuries to the lungs,
Mm.
first of all,
Yeah.
and then potentially to the kidneys. However,
Okay.
there's no concrete data that supports the injury of the kidney from
Okay.
firewood use.
Okay.
However, it causes more issues
To
for
the
the lungs,
lungs.
yes, to the lungs.
Okay. Okay. All right. So now let's move to the what's it called the symptoms.
Okay.
How do you get to know that okay you're actually suffering from something like kidney failure or kidney acute?
Acute kidney injury or
Yeah.
chronic kidney
Yeah,
disease.
all of
Okay.
them.
All
How do
right.
you get to know that you're suffering from something like that? From the starting to the probably higher points of whatsoever it is.
Okay, thank you for that question. So usually, the diagnosis of acute kidney injury
Yeah.
or chronic kidney disease is to be made by a physician, a
Mm.
medical doctor. So usually there are certain things we look out. We take a history, so
Okay.
you get the symptoms that the person presents with, and then there
Okay.
are certain findings that we discover, certain
Mm.
signs that we
Mm.
discover upon examination, and there are some tests that will have
Mm.
to be done to confirm that this person is having kidney failure, this person is having acute kidney injury, this person is having chronic kidney disease.
Okay.
So it's you don't usually just see somebody with one or two symptoms and say, oh,
Yeah.
this
Mm.
person has kidney disease. Aha. So I had to say that as a disclaimer so that you don't see anybody with one or two of these symptoms and just conclude that
That
this
is
is what is wrong with the person because
okay.
there are several other diseases that can have similar symptoms
Mm.
being presented. Okay.
Okay.
So, however, some of the symptoms that you find in persons with kidney failure include swelling, facial swelling. So, there are
Okay.
persons who suddenly their faces begin to swell.
Okay.
Yes, I know when people gain weight, people's faces may enlarge,
Yeah.
but then this often happens suddenly. All of a sudden, this person's face starts to swell.
Mm.
And for some people, they tell you that it swells in the morning when they wake up, their eyes are swollen.
Mm.
Usually, for some people, it can swell to the point that their entire eyelid will be swollen. You
Mm.
can barely see the whites of their eyes. You can barely see periorbital edema. You barely see the whites of their eyes. It
Okay.
looks like they are sleepy. Okay, their faces look puffy.
Okay.
But then over time, as the day progresses,
It goes
from
down.
morning till afternoon, it begins to go down. But then the
Oh.
following morning, it swells again. By afternoon, it goes down.
Okay.
So this happens a lot in persons who have kidney failure. And
Okay.
then also you can find swelling of the legs,
Okay.
pedal edema. So usually it's both legs. Both legs begin to swell.
Mm.
Yeah, so you find swelling of the legs. For some people, it gets to the point where the entire body is swollen,
Okay.
generalized body swelling, and asaka. The entire body becomes swollen because, and this happens because the kidney is now failing to remove excess water from the
Mm.
body. Remember, one of the functions of the kidney is to remove excess water from the
Mm-hmm.
body, and so because that's no longer happening, water begins to accumulate
Accumulate.
within the body.
Oh.
Yes. So another symptom we find of kidney failure is vomiting.
Okay.
Persons with kidney failure tend to vomit. Some people have loss of appetite.
Mm.
Yeah, loss of appetite. And then some people have they begin to talk irrationally
Okay.
irrationally. And this happens when the waste that is meant to have been excreted by the kidney
Mm.
accumulates in the body. They
Okay.
can cross the blood-brain barrier. That's the barrier that protects the
Okay,
brain.
would I say that that now has tempered with the person's mental health?
Yes, so it
Okay.
can result in mental health issues. As a matter
Okay.
of fact, there's a relationship between kidney failure
Mm.
and mental health
Health.
issues. Also, it gets
Okay.
to the point where there's what we call uremic encephalopathy.
Okay.
Yeah, so there are certain toxic substances that the kidney is supposed to excrete. It's called urea.
Mm.
So when urea is not excreted, it will result to accumulation of the quantity of urea within
Mm.
the blood, and this can result to uremic encephalopathy. So the brain becomes affected. And
Okay.
then for some people, they can have uremic frost. Uremic frost is you find some white precipitants on the skin of the person. So you literally see some whitish substance accumulating on the person's body. So these are
Is it play,
precipitants,
the skin is peeling or white substance
whitish
like
substances,
salt?
exactly, beginning to accumulate on the person's skin. So that's uremic frost.
Okay.
Yes, we call it uremic frost. And also remember that another function of the kidney is for production of red blood cells. So
Mm.
when this function is not being carried out, what
Mm.
happens? The individual will not have enough red blood cells in the body. This will result in weakness of the body.
Okay.
Yes, weakness of the body, and then dizziness. Person can have dizziness. So this results in anemia. This
Okay.
results in anemia. Another function of the kidney, remember,
Yeah.
is in regulating blood pressure. So the
Okay.
kidney releases a substance known as renin. So
Okay.
renin is responsible for control of blood pressure. So whenever the kidney becomes affected, this person is now likely to develop high blood pressure. So you see,
Okay.
there's a relationship between high blood pressure and the kidneys. So high blood pressure and even low blood pressure can result in kidney failure. So
Okay.
low,
Okay. Well, before, sorry.
okay,
What actually causes this low blood pressure?
okay. There are different causes of low blood pressure.
Okay. Well, before you
Okay,
answer that question, we're coming
okay,
back to it. All right. We're going on a very short break. A very very short break. Don't go anywhere because you have to stay connected to learn a lot from this man. So stay tuned and don't go anywhere. We'll return shortly. All right, welcome back. And if you just joined us, this is Weekend Gist with Rachel Langs. And actually, we're discussing about a very important topic here. And this is Husky TV and FM. Yes, so I am Rachel Langs, and this is Caleb
Yeah.
Gada.
Yes, you're correct.
Yeah, I've gotten it. All right, so we're talking about kidney failure, right? Before we went on that short break, you were talking about low
Low blood pressure.
blood pressure. I was asking you what actually causes that because recently I've heard a lot of people talking about low blood pressure. So
Mm,
I was wondering, I know of high blood pressure,
mm,
but low blood pressure, I was wondering what could actually cause that.
mm.
I really want to learn now.
All right.
Yeah.
Yeah, that's a very good question. So, one of the causes of low blood pressure is anemia.
Okay.
So, for example, whenever someone bleeds a lot, bleeds so
Okay.
much. So, for someone with menorrhagia, which is someone who bleeds so much during menstrual flow,
Mm.
that is a risk of developing low blood pressure. Also, for
Okay.
persons who might have been involved in an accident,
Okay.
and there is acute blood loss, there is sudden loss of blood, large quantity of blood. This can
Mm.
result in low blood pressure. Another cause of low blood pressure is overwhelming sepsis. So that is overwhelming infection, systemic infection. So
Okay.
in simple terms, an infection that has gone out of control
Mm.
and several organs of the body are now being affected. So sepsis is another cause of low blood pressure, and also some metabolic disorders in the body like
Okay.
hypothyroidism can result in low blood pressure. So low blood pressure is a risk of developing acute kidney injury. Also, high
Okay.
blood pressure is a risk of developing chronic kidney disease. Okay,
Okay.
and at the end of the day, kidney failure, which
Mm.
is chronic kidney disease or acute kidney injury, can result in hypertension. So it's like a vicious cycle. So
Okay.
one can lead to the other, and the other can
Can
lead
lead to
to
the other.
exactly. So there's that
Okay.
relationship that exists,
All
and
right. Before I ask you that question, you talked
okay,
about in the symptoms of kidney failure.
yeah,
You talked about swollen body,
yeah,
face, and whatsoever. And so I had a neighbor before who
okay,
had that same issues of swollen body, feet, and whatsoever. Once you press it, it
mm,
goes down. It
yeah,
take times to come back,
yes,
and afterward,
mm,
we lost the person. But what, according to what I heard, the doctor said that
mm,
it's at the result of using a particular cream.
mm,
Yeah, that he was using a particular cream. So I don't know if there are some chemicals
mm,
or things that mix in our creams
mm.
or some particular creams that actually temper with our health that we don't know. We just go on and buy creams and rub without actually checking that, okay, would this temper with my health or would this help with my, we are talking, people like beauty.
That's right.
Yeah, you
Beauty is
just,
good business.
man,
Yeah.
you just see one fine girl on the cream. Is this one I want? Without checking the content. Me, I actually check content, but I don't actually know what I'm looking out for. So, what are we
Yes.
supposed to actually look out for in our
Okay.
creams when we're buying them?
All
So
right.
that we know. Sisters we like bleaching and brothers. Make I hear this one. Me, na Vaseline at the rope.
All right. That's a very good question, Miss Rachel.
Yeah.
The creams we use are really, really important.
Okay.
Remember, the skin serve as protective barrier
Okay.
for our body, so they protect us from the external environment.
Mm-hmm.
However, substances can cross
Yeah.
the skin. So
Okay.
whenever we apply creams,
Yeah, the
the
skin
cream,
absorb.
the skin absorbs them.
Okay.
So the reason bleaching creams function in the body is because they can cross the skin
Okay.
barrier and then cause certain changes in the body,
Hmm.
reduction in melanin levels that will now result in people's skin becoming brighter. So
Mm.
it's simply the loss of the melanin pigments that
Mm.
is contained in the skin. So since these substances can cross the skin,
Mm.
there are certain harmful substances that are found in creams that can result in kidney damage because
Okay.
these substances get absorbed into the system, into the blood, and they get to
Mm.
the kidney, and the kidney has to metabolize them at the end of the day. So
Mm.
two key substances that have been implicated in causing kidney failure are mercury.
Okay.
Yes, mercury has been implicated, and
Okay.
also there is a chemical known as hydroquinone. So
Okay.
mercury and hydroquinone have been implicated in causing kidney failure.
Okay.
Yes, so probably the cream that the person was using, and even some soaps have been implicated in
Okay.
causing this. So, for sake of this broadcast, I may not be able to mention certain brands. So, it
Yeah.
is advisable whenever you're about to buy a soap
Or
or a cream,
cream.
it is important to
Check.
check the content. So, number one, mercury. Mercury. Mercury is spelled Mercury. I take that again. Mercury. And
Mm.
then another substance to look out for is hydroquinone.
Okay.
Hydroquinone. So I'll take the spelling of hydroquinone. Hydroquinone. I take the spelling again of hydroquinone. Hydroquinone. So look out for these two substances, mercury and hydroquinone.
Mm.
They've been implicated in causing kidney injuries. Yeah.
No one I don't hear. Anyway, all right. So, another question: Do okay? You said the kidney actually is responsible for whatsoever we take in. Yeah. So, are there particular food or fruit that, when you take in excess, can actually cause any damage or any trouble to your kidney?
All right, that's a very good question. So, it's a popular saying that too much of everything is bad.
But
Aha. So I wouldn't say food have a direct impact on the kidney.
okay.
Yes, but rather what can happen whenever one takes in high calorie diets. By
Mm.
high calorie diets, I mean food which contain lots of sugar,
Okay.
lots of carbohydrates,
Mm.
especially eating at night. This
Mm.
can result in obesity,
Okay.
and obesity can result in kidney failure.
Okay.
Another thing that can result from intake of high calorie diet is diabetes,
Mm-hmm.
and diabetes can result in kidney failure. So you see there is a relationship between eating healthy,
Mm.
eating balanced diets,
Mm.
eating food at the right time, eating the right proportion,
Mm.
and eating the adequate consuming adequate classes of food. There's a relationship between good dieting and having a healthy kidney. And also
Okay.
exercise has an impact on the kidney, because
Okay.
exercising means that you are going to detoxify your system, you are going to sweat a lot, so
Mm.
the skin is also going to function in excretion. It
Mm.
wouldn't just be the kidney alone, and then whatever toxic substances in the body
Mm.
would be excreted, and it helps people to maintain a good BMI, body mass index. It
Okay.
helps maintain a good body mass index. That's the relationship between the weight and the height of individuals.
Okay.
Yeah.
All right. So now let's move to the next question.
Okay.
How can how can one maintain a healthy kidney?
Mm. All right. So the first point I'm going to make is hydration.
Okay.
Hydration is key.
Okay.
Drink lots of water.
Okay.
Drink lots of water. There's a popular saying that water does not have enemy. A popular
Mm.
Nigerian musician once sang that water does not have enemy.
Yeah.
Yes, so drink lots of water, because drinking lots of water is going to keep your system hydrated. It's going to keep your kidneys irrigated.
Okay. Sorry. Before you
Yeah,
go further, you
okay.
said drink a lot of water. So
Yes.
actually, I want to ask you this funny question. It might
Okay.
actually be funny, but you will see someone. Okay. Let me now set example with myself.
Okay.
Probably, I'm so thirsty, and
Mm,
then and now I find myself water, and
mm.
then I decide to take in excess, like plenty, and then you notice sometimes when you drink plenty water, you start having stomach pain or whatsoever. Is it okay?
Okay. All right. So for the abdominal pain that may occur after drinking water, usually is experienced when one has not eaten for a long period of time.
Okay.
And so that's when that usually happens, when you don't eat after a long period of time. But then it subsides on its own.
Yeah,
The
it
pain,
later goes
yes, it
down.
subsides.
So I'm talking of in a situation whereby probably you eat something that wants you to be drinking water
Okay.
frequently, most especially like beans,
Mm,
and then you have been drinking water where your stomach is actually full,
mm.
but from your throat to your mouth wants to drink water.
I get. So you are having that sensation of thirst, but
Okay.
you are actually satisfied.
Yes.
Yeah. So that can be an issue. Now, despite the fact that you should drink a lot of water, it also the stomach has a capacity,
Yeah.
and you cannot exceed the capacity
Your
of the
stomach no
stomach.
full, so
So it is now important to not take too much of the beans, for instance.
okay.
So
Oh,
whenever you are eating the beans, you should remember that there should be space for the water.
okay. Oh, I
Because
love
and
this.
the body is so amazing. It has a way of communicating to you.
Yeah,
You would always know when it is okay, when the consumption of beans
it's
is now
okay
okay. So whenever your body begins to give you such signals, it's because it's trying to tell you that there should be more space for
for
water.
water. But your
Exactly.
mouth is telling you eat, eat.
So it's really important to control what we eat, the quantity of what we eat, and it's
Mm,
important to take in lots of water. Now, the fact that we should take in lots of water does not mean we should take 5 gallons of water in a day.
mm,
So it's advised to take at least 2 liters of water in
okay,
a day.
okay.
At least 2 liters of water. So, in other
Mm,
words, you can take two sachets of water if you are using sachet water as a reference, two sachets
mm,
of water in the morning, three sachets of water in the afternoon, and
mm.
then two in the evening. That's
Okay,
fair. And if you are taking bottled water, you can still do same.
okay.
Morning, afternoon, evening. More so the fact that we are in sub-Saharan Africa and the weather in this environment can be
Mm,
really hot. It is important to drink lots of water. We have discovered that there is an association between dry season
mm,
and yes, dry season in this part of the country, northeastern part of the country, the core northern part of the country, and the incidence of kidney failure. So
okay.
during that period, there is usually an increase in kidney failure. But even during rainy season, there are periods that can be hot, and people
Yeah.
sweat a lot, people lose a lot of water. So it's important to consume water a lot. So
Okay.
another way to prevent kidney failure is to have regular checkup. Prevention is better than cure.
Of course.
And sometimes there may be an issue with the kidneys, but it is silent.
Mm,
Yes, it is silent over a long period of time, and all of a sudden it packs up.
mm,
So it is now important to carry out medical checkups at least once in 6 months. That is
okay.
twice in a year. So at least once in 6 months, walk into a health facility near you and request for routine medical investigations to be
Mm,
done for you to assess the function of your kidneys and even other organs of the body. Because some of these derangements are noticed, they are picked, they are detected incidentally.
okay.
So sometimes you find somebody come to the hospital to have treatment for a different disease, and then we now realize that there is also an issue with the
Mm,
kidney. So it's important to have regular medical checkup. It's also important to stay away from things that can cause kidney failure. Stay away from smoking much as possible. Stay away from smoking. Stay away from environments where people smoke.
we
And
didn't
then
actually talk about alcohol.
alcohol, yes, alcohol has an impact, even though it has more impact on the liver because the liver does the
Oh,
first stage of metabolism
okay.
and detoxification before
Mm,
it
the
now gets to the
kidney.
kidney. So it's
Okay.
also important to stay away from alcohol. The impact of alcohol is that it can result in high blood pressure, and the high
Okay.
blood pressure can affect the kidneys,
Kidney.
yes. But the direct impact of alcohol is majorly seen on the liver, where it
Okay.
causes fatty liver disease. It can result in even liver cancer.
Oh, wow.
Yes,
That's serious.
it is serious. It is
So
serious.
don't
So
use your money and buy cancer.
yes, so as much as possible, stay away from toxic substances
Yeah.
like alcohol, like cigarettes. Stay away from creams that contain mercury and
Mm.
hydro and hydroquinone.
All right. I hope you're listening. All right. So, what are the differences between kidney stone and kidney uh, failure? Because I've heard a lot of people saying, okay, she has been diagnosed with kidney stone, or is it the same thing?
All right.
Kidney failure.
Okay, so kidney
Uh,
stones actually they are crystals that are precipitated
okay,
within the renal system.
okay,
Yes, and this is as a result of the presence of certain substances. It may be a calcium crystal. There are
okay.
certain pigment crystals that may be precipitated within the renal system. So
Mm-hmm.
these form stones. They are
Okay.
crystals. So we call those crystals stones.
Stones.
So what
Okay.
happens is that these stones can block a portion.
Okay.
Yes, let's say the ureter.
Hmm.
So it can block a portion of the ureter, and when that happens, urine will not be able to pass through.
Oh.
So whenever there is a blockade, first of all, there will be pain, there will be feeling of pain because
Mm-hmm.
of that blockade, the impact of the stone
Hmm.
on the urethral wall. And
Yeah.
then secondly, because there's an obstruction there and there's accumulation of urine and it's not going out, there will be a stretch of the capsule
Okay.
because it's accumulated there, and then it can also result in pain. So
Hmm.
this kidney stone, if it is not treated, can now result in kidney failure over
Okay.
time.
Mm-hmm.
So the relationship between these two is that kidney stones can actually result in kidney
Kidney
failure
failure.
over time.
Okay.
Yes. So
Okay.
that's the relationship that exists between the two. So these are two entities, but one can result in the other.
Okay.
Yeah, so kidney stones can cause kidney failure.
Okay. So, is there any specific age range
Mm.
for kidney failure, or
Failure.
for them to probably maybe from 30 upward, or
Okay.
from 40 upward, or from 10 downward,
All right.
or it can happen to anyone, even a child at birth. It can happen to anyone.
Okay, so kidney failure has been found by research to occur more in persons who are 65 years and older.
Okay.
Yes, so it is more likely to occur in persons who are at
Older.
65 or older
Okay.
because age has an impact in that. And then remember, the kidneys work for years and they
Mm-hmm.
can be overworked.
Mm.
So with time, the function reduces.
So they will expire.
I wouldn't want to use that word, but then over time, the function of the kidney begins to
Reduce.
decline. Exactly,
Okay.
it begins to decline. So persons who are 65 years and older, and if you look at the risk factors I
Mm.
mentioned earlier, a lot of them are associated with people of that age. For
Okay.
example, hypertensives.
Mm.
Hypertension is commoner in persons of elderly persons. Diabetes
Mm.
mellitus is also commoner in older persons.
Yeah.
And then it can also occur in persons of other age range,
Okay.
but then it is commoner among persons greater than 65 years. For
Okay.
example, a young man of 32 has an accident, a trauma to
Mm.
the kidney.
Mm.
This can result in kidney failure, even
Yeah.
though this person is just 32 years old.
Yeah.
Another person who is 45 years old, who has been a chronic smoker, can come down with that because he's a
Yeah.
chronic
He has
smoker.
been
He
smoking.
has been smoking for long. But then, from the data available, most persons come down with kidney failure from the age of 65 and above.
Okay. Okay. I've heard a lot of people say, okay, this person probably is an elderly person, so doctor says he should not eat this, he should not eat that, he should not eat this because of his age, or it might actually cause him harm whatsoever. Okay. Now, more especially, let's go to the meat part of it, red meat.
Yeah.
So yeah, so what actually? Okay, what do was it red? Is it red meat
Oh,
that
yes, red
they're
meat.
actually advised not to eat when you get to a certain age,
Yes,
right?
yes.
So what does this red meat do in the body
All
of
right.
an aged person?
Mm. All right, so it is generally advised for persons to consume less of red meats
Yeah.
and then more of fish.
Okay.
Yeah, the reason for more of fish is because fish contains some healthy oils. You might have
Okay.
heard of omega-3.
Yeah, yeah.
So there are certain oils in the body that are healthy. So,
Okay.
yes. But then red meats contain high level of calories
Mm-hmm.
and then also cholesterol
Mm.
and certain substances that can result in high blood pressure and some
Okay.
other metabolic issues in the body. It even has a relationship with diabetes. So
Okay.
as a result of that, it is we usually advise people to take more of fish
Okay.
and
Yeah.
less of red meats because of
Okay.
such impacts that they have on the body.
Okay. And again, because the kidney now is kind of
Is at the receiving
retiring.
exactly is
Okay.
at the
It's
receiving end of it,
yeah,
and
and
then
it's
it has
kind of
been
weak.
overworked after several years, several
Mm.
decades.
Okay. All right. So um, elderly people will like chop meat. Make sure they give us meat. All right. So, what's your like last take for our viewers and listeners, and more especially probably those that are going through this kidney trauma problem or
Mhm.
whatsoever, or just that their kidney are still healthy?
All right, so it is said that prevention is far better
Thank you.
and cheaper than cure. It's far better to prevent than to treat
Yeah.
or to cure. So it is important to um, adhere to preventive measures.
Okay.
Drink lots of water.
Mm.
Drink lots of water, especially for this part of the country and for
Mm.
this part of the world. I know it is normal to drink water when you are thirsty,
Mm-hmm.
but in this part of the world, you should drink water not only when you are thirsty.
Okay.
Yes, so it should be regimented. So drink lots of water. Stay away from toxic substances. Stay away from toxic substances like cigarette smoke. Stay away from creams that contain toxic substances,
Mm.
hydroquinone and mercury
Mm.
that we had mentioned earlier. And then for persons who may be battling with one form of kidney issue or the other
Mm.
at this point in time, I want to extend my voice to you and to encourage you that there is hope for you. Okay, this
Mm-hmm.
is to encourage you and to comfort you. And wherever you are right now, if you're at home, you can go to a nearby facility so that you can be checked. There are certain measures that can be taken
Mm.
to help to address your issues. There are certain medications that you can be given to treat you. And if it is at end stage already, a dialysis can be done for
Mm.
you, and then in extreme case scenario there can be a renal transplant, that is kidney transplant from a
Okay.
healthy individual to another person. So
Mm.
once again, prevention is far better than cure. Thank you very much.
All right. Hmm. Oh, sorry.
Okay.
Drink a lot of water. If you don't have water at the moment and you're kind of thirsty, is it okay to drink anything? Fanta, Coke, malt, whatsoever?
It is
It's
advisable
liquid.
to take water because those other substances have other solutes. So whenever
Um,
the body is thirsty, it is important to
to drink
get
water.
water.
Okay. All right. You have said it all, and I'm 100% sure that he did justice to this particular topic, kidney failure. And I don't have anything to say much, but I am backing him up that whatsoever he said is actually right. This is not a don't come up vlog me and you. Alright, please drink a lot of water and stay away from things that would damage your health. Yes, that's the only thing I will tell you right now. Before I go and call one name, before I go and say something that I don't know, because you have been blowing grammar here, I'm just looking at you. Alright, so alright, join us next week, the same time, the same station on Hasket TV and FM on Weekend Gist with Rachel Lance. And I am saying goodbye. I am Rachel Lance. Have a beautiful evening. And here's
Dr.
Caleb.
Caleb Agada,
Yes,
have a wonderful weekend.
yes. Catch you next week with another interesting package for you.